Hi everyone, welcome back to the program. You're watching Ask the Family Doctor on America's Health Network, and we're visiting tonight with Dr. Tian Dayton, the author of the book Heartworms. I was going to be like, ask the vet. Heartwounds is the name of the book, about dealing with grief and how it affects our relationships the rest of our life. If you have a question for Dr. Dayton about this crucial part of growth and growing and aging, give us a call right now. We've got some lines open at 1-800-ON-HEALTH. That's 1-800-664-3258. Dan, when we talk about human response to fear, human response to trauma, we talk about the old flight, fright, freeze. Let's go through those one at a time. The first natural response to a major trauma, to fear that can come from trauma, is what we call the fight. What therapists call the fight. What is that? Explain that to our viewers.
That's just fighting, defending, lashing out.
Getting defensive.
Getting defensive or aggressing against something.
Getting angry.
Getting
mad.
Getting rageful.
Can that include that passive aggression too, where we turn it in on ourselves?
Sure, but the initial, the fight, flight, freeze has a really unconscious side to it. It's really designed to let us survive situations that we wouldn't be able to get through because we're so overwhelmed with feeling.
It's natural, it's inborn, it's created,
exactly.
It's part of us, we can't get rid of it.
Can't get rid of it. Feeling shuts down, survival systems come up. So we go into fight, flight, or freeze, and we don't process the emotions or the thoughts along with it. We repress them, or we throw them out, what we call dissociate from them. So we need to revisit those traumatic moments so we can feel the feelings and think the thoughts that we would have thought had we not
the flight
been frozen.
part? So we've got the fight part. What's the flight part?
Flight part is either physically leaving, or in the case of small children who can't physically leave, they dissociate. In other words, they fly away in their mind. They're there in body, but their spirit and mind is gone.
Okay, maybe even magical thinking?
Magical thinking, gone.
And then freezing?
Freezing is shutting down. Freezing is just, I'm here in body, but I feel nothing. I've shut down my feeling systems.
The numbness, the
coldness.
And to not begin the, and we're not talking about going to someone for psychotherapy for 5 hours, 3 times a week for the rest of your life. But we are talking about getting the support you need, whether it's a pastor, a priest, a rabbi, a support group, or a therapist, to help as fellow human beings to walk through that process to improve and preserve both mental, physical, and spiritual health.
Well, trauma is a rupture in a relationship bond. So if we don't grieve it and walk through the grief, we don't bond again. And a relationship with God is also a relationship bond, a relationship with self, a relationship with others. We need to grieve what tore that bond asunder so that it can re-knit itself.
Great. Well, we've got several people waiting to talk to us, so let's go first to Esther. Hi, Esther. Welcome. How can we help?
Hello. I've got, my husband got killed in a car accident in September, and I've got 5 small children.
Oh, my goodness.
And they're, the oldest is having problems with it.
Okay. We can hear one of them in the background, Esther.
Yeah, little girl.
So, Esther, you lost your husband in September to a car accident, and your children range in age from how young to how old? 1
to almost 10.
Oh, what a terrible thing for them and you to have to go through. I can't even imagine how hard it's been. What's your question for Dr. Dayton?
I think that see if I can find out how I could help maybe the kids deal with it.
Yeah, great.
Couple of points.
Great question.
Great question, Esther. First of all, help yourself, I would say. Help yourself grieve. Give yourself time separate that you can tune in on what's going on inside of you and go through the painful feelings. And don't hide them from the children, but give yourself time on your own and let the children see some of it. And with the children, allow them to have their feelings. It'll be easier for you to allow them to have theirs if you allow yourself to have yours. Then connect the kids up with other support systems in their world. Let them reach out and find help in the world around them.
Well, let's talk about some practicals for Esther. First of all, she needs to learn to listen, to ask questions, to give the kids time? Would that be one?
The kids will come up with it. They'll start feeling it. If she doesn't ask questions, they probably will say it anyway. The best thing is to tune in on when they want to say it. Those little moments with kids when it's bubbling forth, put down what you're doing and listen to what they're saying.
And Esther, these aren't times that can be programmed or set, but will require just spending time. Tian, I hate that quality time concept because I find with kids it takes quantity of time.
There's no such thing as it's all quality time. And if you force kids into a little box of quality time, it's in your schedule.
So be able to share your grief, it's to be able to cry with the kids, to be able to hug them when they're crying, to spend time with them. And then as far as specific support, Esther, you've got kids that are, how many that are school age?
4.
So 4 of the 5.
He had to go to Head Start.
How helpful would the school psychologist, would the teachers be? Can Esther recruit them as part of the kids' support?
Yes, that's a very good point. Alert your support system, Esther. You probably already have, but talk to the school system and let them know what's going on so they're all briefed. And the children will find a lot of relief in being part of their daily activities, going to school, being in sports, clubs, being with friends. Let them, return to life as much as possible, and yourself too.
Esther, we wish you the very best. I can't even imagine the difficult path that you're walking, and I appreciate your courage in giving us a call and getting this advice. And I've got to tell you, I really would recommend the book Heartwounds to you to begin that process yourself. We wish you the very, very best. Thanks for calling in, Esther. Tian, I just want to, I know that Esther's going to get stronger. I know that, but it must hurt so bad.
What a loss. What a tragedy.
And yet, if Esther does not, and if the children go through the process of developing a strategy for dealing with this, one of the points of your book is that every other relationship down the line is going to be harmed. And there's people sitting at home saying, oh, come on, Tian, how can that be true? Are you nuts? How is it true?
It's true because when you repress pain, it doesn't go away. We think we can put it aside and it will disappear, but it doesn't. The brain is far too complex for that. We store it in the brain. We store it now in the body, we think. And it gets triggered by other relationships. And when it gets triggered, it comes to the surface very quickly, and we act it out. And if we don't understand the pain that's getting triggered, we misperceive. And we think that the person who's talking to us is to blame for everything. We can't separate the past from the present, so in that way it sabotages current relationships.
Tian, they tell us in family practice that 60 to 70% of what we see has psychological roots to it. Repressed anger or grief that's not dealt with. Is that what you're saying, that it can actually have not only effect on our relationships, but physical health effects also?
The immune system goes down with repression. You know that as a doctor. Sharing feelings, group therapy, 12-step groups, church groups are one way of elevating the immune system.
So for a man to say, well, I'm going to be strong, I'm going to hold this in, I'm going to bear it, that's actually nuts. He's going to hurt himself.
Why bear it? What is the strength in that? I wonder. It's
actually a weakness.
It's a weakness. It takes much more strength to say, I'm not going to hide this. I'm going to turn and face this pain. I'm going to walk through it, and it will feel like the jaws of death.
But unfortunately, that strength, that courage to do that is the road less traveled.
It's the road less traveled, and I think that's why we have sexual addiction, food addiction, alcohol and drugs, gambling. That's that pain that drives those addictions.
What an important part of American health, and I'm glad you're watching to hear this tonight. Let's go to our next caller, who is Arlene. Hi, Arlene. Welcome.
Hi, how are you?
We're fine. What's your question?
I had a question for anyone there, because this is something I always wondered about, and I was wondering if there were any studies ever done on it. I was wondering if, regarding the concept of love, what a woman thinks love is versus what a man thinks love is could possibly be different.
Oh, boy.
And that's why later on down the road you wind up separating and
question.
Well, it's a great question, and actually, I'm going to let Dean come from the psychological part, but I've got to tell you, Arlene, men are brain damaged, and let me explain what I mean. We've got a left brain and we've got a right brain, and very often that left brain deals with projects and getting things done and dealing with practical things, and the right brain is where we abstractly think and some of our emotions come from. And when we're little bitty children, the hormones changes that we go through for a man actually destroys some of those cross-linked fibers. That area of cross-linking between the two sides of the brain is damaged in a man. So a man is, if you would, sort of biochemically brain damaged. But how does it work out relationship-wise on the way that men and women deal differently? Well, not only with love, but with grief.
I think it's good to just know men and women do deal differently. We tried to make one size fit all in the 70s and early 80s, but it doesn't work. Men and women are different, and men are generally more comfortable with anger, women with tears. I don't think men and women at the heart of it love so differently. I think we might have an easier time as women admitting to dependency and need. I think men have a hard time understanding how dependent they are, or not feeling as if they're going to be smothered and swallowed up by a relationship. Women tend to worry about abandonment.
But to learn how to talk together, to listen together, to communicate together, to understand each other, to use each other's weaknesses and strengths to knit together in a relationship that gets healthier and healthier, not only for life, but as you say in your book, for generations. Tian Dayton, it has been such a treat to meet you. The time has flown by. Thank you for the principles that you've taught millions of Americans tonight on how to heal.
Thank you.
So you guys, her book is Heartwounds. It's available in all the better bookstores. You've been watching Ask the Family Doctor on America's Health Network.